Question number 7, Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. Does he stand by his statement that resources in Budget 2014, quote, will help us continue to improve frontline health services for New Zealanders?
Mr Speaker.
Honourable Michael Woodhouse.
On behalf of the Minister of Health, yes. The best example of this is free doctors' visits and prescriptions for under 13-year-olds from July next year, with 400,000 children benefiting. The member will be interested to hear that we've been able to afford this because we've turned around Labor's DHB deficit of $200 million to just $20 million.
Mr Speaker.
Supplementary question, the Honourable Annette King.
Well, in light of that answer, why then are orthopaedic patients referred to Hutt Valley District Health Board being told that only urgent cases can now be done? And is that the improvement New Zealanders would get under a national government?
Mr Speaker.
Honourable Michael Woodhouse.
Well, Mr Speaker, in respect of orthopaedic services, a lot of work has been done to ensure that only the most urgent cases are referred to orthopaedic specialists. The GPs with Special Interest program has been a very good strategy of making sure that there is an appropriate filter through which patients are referred, and indeed, as a consequence of smart thinking, including by this government, significant increases in elective surgery, including orthopaedic surgery, have been achieved.
Supplementary question, Honourable Annette King.
In light of that answer then, have orthopaedic operations increased or decreased per 100,000 population under a national government in the following DHBs: Bay of Plenty, Hawke's Bay, Capital and Coast, Northland, Tairāwhiti, Wairarapa, West Coast and South Canterbury? In other words, half of the DHBs.
Honourable Michael Woodhouse.
On behalf of the Minister of Health, obviously that is a very detailed question which I don't have the answer to hand, but I would be very happy to reply if the member would put it down in writing.
I could answer for you if you like, Mr Speaker.
Well, your member might have to wait for the luck of a general election to have the opportunity. Honourable Annette King, supplementary question.
Thank you, Mr Speaker. If there is sufficient funding in Budget 2014, why is the Waikato DHB telling health professionals that service involving psychologists have increased beyond their capacity to deliver, and children with ASD, learning difficulties and intellectual disabilities will have to wait longer for appointments? And is that improvements for kids in New Zealand under a national government?
Honourable Michael Woodhouse.
On behalf of the Minister, obviously I would have to go and fact-check the paraphrasing that the member has included in his question, but what I would say is that under this government, did I say his? I do apologise. Her question. But I can say that under this government, DHBs have been innovative in ensuring that they can produce much more output for a moderate increase in budget, and they have been spectacularly successful in doing so.
Supplementary question, Mr Speaker.
Supplementary question, the Honourable Annette King.
Was Treasury correct in their recently released budget report when they said, quote, the funding package requires a very real challenge to DHBs, and given the fiscal environment, there is a risk of longer waiting times for patients and unforeseen health consequences?
Honourable Annette King.
Mr Speaker, as that member, on behalf of the Minister...
Order. Honourable Michael Woodhouse.
Thank you, Mr Speaker. On behalf of the Minister, obviously the calculations of an appropriate budget increase to meet the changing needs of New Zealanders, including an ageing, different geographic and ethnic mix, is always a very complicated process. But nevertheless, we have been able to achieve significant increases. And I should point out that doing the same thing year in, year out would have got us the same result, which is why, under this government, we have been innovative in investing in things like increasing childhood immunisation, investing in rheumatic fever management, warming up our homes so that we prevent those conditions from occurring in the first place.
Supplementary question, Honourable Annette King.
Were DHBs told that Budget 2014 funding was for demographic pressures with, quote, a contribution to cost pressures, end quote, and has that led to DHB's offering a 0.7% pay increase to staff, while inflation is predicted to be 2.2% 2014-15 according to Treasury?
That's miserable.
Honourable Michael Woodhouse.
On behalf of the Minister, in respect of the first half of the question, while I can't verify the quote, I have no reason to suspect that it is incorrect, because indeed that what the budgetary increase was designed to achieve. But as I say, we have been very impressed with the manner in which the HBs have been able to do a lot more with a little more.
Question number 8, Mike Sabin.
Thank you, sir. My question to the Minister for Primary Industries: what recent announcements has he made regarding government support for the primary sector in Northland?
Honourable Nathan Guy.